Thank you for having us today, first of all. Like Oliver said, we just want to give you guys an overview of what we do at the International Secretariat and present to you our current activities and projects that we're working for. And as Oliver said, there'll be time at the end if you have any questions or comments or suggestions about how we can support you. So we are a 5-person team based in Hamburg, Germany. Oliver and I are here with you today, but there are 3 other people who work kind of behind the scenes with strategic and operational support. The International Secretariat, as you probably know, works very closely with a 7-person governance board led by Dr. Christensen. In the governance board, there's representation from Sweden, Australia, Italy, Hong Kong, Spain, Finland, and Taiwan. So the governance board is a great reflection of the international members that we have. We have currently about 560 members in the international HPH network. There are 20 national and regional networks. We have some countries where there are multiple regional networks within the country. And there's 33 countries represented in total. Sweden has about 17% of the memberships within the network. You can see the little graph under there. There aren't exactly 93 members, but in Sweden, as you know, some of your regions are larger than others. So one region might have multiple memberships within our network, depending on the size of the region. So, the role of the Secretariat is to support and represent the network in numerous amount of activities. We maintain multiple communication channels where we keep everybody up to date on what's happening. We also do a lot of collaboration with external stakeholders, financial management such as the yearly budget, accounting, and then we also keep track of all the membership payments. I'm going to go into a little bit more detail about the projects, but you can see some of the main ones that we're working on now. We're working on drafting the global strategy for 2020 through 2025. We're working on defining umbrella standards for health promotion in hospital and health services settings. And then we also are drafting ideas for an e-learning and implementation platform. So if you want to keep up with what the network is doing, you should take a look at our website. That's our central hub for information, events that are happening within the network and all the developments. We are also present on Twitter and newly on LinkedIn. If you follow us there, we often retweet events within your network, of course, if they're open events. So that's a really good way to be involved internationally with the larger network. So the network is very much involved with partnering with like-minded organizations and other NGOs. The goal here is to work together to set the agenda and advocate for health promotion. We are working right now with the World Health Organization. We've made a contact, Dr. Azopardi. She will be keynote speaker at the upcoming Baltic conferences. And we hope to work towards obtaining WHO affiliation in the near future. Once the global strategy is completed, we will put more work into that. We also work with the International Hospital Federation. And during the COVID pandemic, we worked with Planetree International. The International Secretariat was involved in a pop-up coalition of more than 60 international institutions to draft guidelines for preserving family presence. The partnerships also give our members an opportunity to participate in webinars. For example, Healthcare Without Harm. Members had the opportunity to participate in a webinar about healthcare and climate change. Yeah. So now I will pass on to Oliver, who will give you a little bit of information about the global strategy of the network. You're muted.
Who are you referring to, Keriin? I don't think Oliver is not muted. No.
No, that's fine. I was just writing in the chat because I couldn't unmute myself.
Okay.
I think you just took care of that. So great. Thanks for that, and thanks, Keriin, for starting. I'd like to go into a little bit more detail now about three of the key developments we've been working on very intensively with the governance board and with our partners. That is the strategy, the standards, and the e-learning. The strategy document actually started quite a while ago, and I think with some of the changes, both at the WHO level and also with the wider network, it took a bit longer than expected to have this finalized, but we're now on really good track. We have a very clear timeline to have this strategy document published by the next General Assembly, which will be later this year. And that document will tie in very strongly with the activities of the Secretariat to support networks in implementing the quality improvement strategies, the umbrella standards, supporting e-learning, but also broaden the vision of the network. Because in the past, there have been a lot of discussions about the focus of the network, and a lot of energy has addressed the very specific activities that are closely related to clinical work. And of course, they are highly justified. But we believe, and I think the broader network supports it, that we need to re-embrace the original broad vision of the network, because it's not enough to change professional roles and introducing health promotion activities on top of existing clinical activities, but to embed them more strongly in the wider healthcare delivery design, and also in terms of addressing the wider challenges that we are facing in societies. So I'm quite pleased that we've made good progress on this document. For reasons, since the document is still under consultation, I can't share any details with you yet, only to promise that we're doing our utmost to have this published by the General Assembly later this year. Next, please. We can go into a little bit more detail about the umbrella standards. Again, the standards development is a project that has been going on for quite a number of years. And I think it's definitely overdue. I was happy to have been involved at the beginning of this process, really, when we started thinking about translating these ideas and visions of health promotion into quality standards. And you can see this green manual. This is some of the outputs of that work quite a while ago. In the last years, there were two parallel strands of work on moving these standards forward. And one strand of work was to look at the behavioral standards, so particularly regarding coaching and motivational counseling, aligned with some of the key risk factors in healthcare, such as alcohol and smoking. And on the other hand, the work led by Dr. Antonio Chiarenza to look at the standards more broadly, to reflect on the vision of health promoting hospitals, and also to build on the work done in quite a number of task forces and working groups. As you're aware, we have some task forces looking at particular needs of patients in the elderly or in adolescents or amongst migrant groups or in terms of health literacy. And Dr. Antonio Chiarenza presented at the last General Assembly a proposal to integrate those standards and the standards from the behavioral interventions into an overarching standard set. And this is what we call the umbrella standards at the moment. And we have set up an expert panel to review the current status of these expert umbrella standards to make sure they do reflect the broad vision, but also that they are relevant and applicable to your work. And we will move through a process to have this document also finalized before the General Assembly later this year. I can give you a little bit more detail. We set up 2 rounds of Delphi consultations. And in the first round, we wanted to know from our experts whether they agree with the scope of the standards. And this is where a lot of the discussions were in the past, because many people believe that some of the standards that were being developed were too narrow in scope. So we really wanted to ensure that we arrive now at a standard set where you feel they do really reflect not just your work, but also the vision of what we're working towards. We have finalized this first round, and you will be the first people on the globe to see some of the results of this round. Actually, we've just extracted it from the database 2 hours ago, so it's really, really fresh. We haven't analyzed it in great detail yet, though, so please keep that in mind. But based on our analysis of this first round, thank you, we will go into a second round and rate the individual components of the standards. And here the purpose of that round will be particularly to identify those standards and measurable elements that you feel are the most important priority issue at the moment. So on the one hand, we have a broad set of standards which reflect the vision. And on the other hand, we will have a lot of items and questions that can be assessed locally. This is the framework that Dr. Antonio Chiarenza developed and was also presented a number of times to the General Assembly and the Governance Board. And you can see that a lot of these standards have some overlap. For example, all standards include some element of measurement of performance or policy and leadership. So we suggested to have that reflected into one overall domain here labeled as organizational commitment. And there are now 7 domains, from organizational commitment over staff and accessibility towards promoting health in the wider society. And I'm very thrilled that we were able to address this last component, because I feel this is really an area where the network has a lot to offer, where it has a lot of history and tradition, where a lot of the motivations are of people supporting the network, and where we will now be able to offer a specific tool to align our strategies with specific actions in hospitals and health services. Next, please. This is just an example on specific measurable elements for you to understand the structure. So for example, there was in the clinical standard set, a standard on patient assessment and needs documentation that has substandards, and each substandard has a list of measurable elements. And you can easily imagine that conducting this exercise and adding all measurable elements across the standards would result in a very long list, which would create a burden of data collection and assessment in health services. And we want to bring this list down to a smaller list based on the assessment of the members. Next, please. The Delphi study was conducted online. This is how it looked like. There was a description of the overarching standard and its domains, and questions whether participants felt it was clear, relevant, and important, and also very important, a section to provide additional comments. Next, please. And these are the first results that we just extracted this morning. I'm afraid there are 3 numbers missing here. Sorry for that, but this is because we just extracted that just a few hours ago. And you can see the ratings, which ranged from 0 to 7. 0 meaning no agreement, 7 full agreement. And it's positive to note that overall, all dimensions received reasonably high ratings. That is, of course, logical in the sense that these were derived from previous standards documents from the working groups, which were also co-developed with the national networks and individuals. And it would be surprising if now those dimensions didn't receive a high level of rating. But also important, there's some heterogeneity in the ratings. Some are very highly rated, others not so high, which is really useful for us to understand how we can better formulate these standards and also how we can prioritize them.
Oliver, I have a question.
Yeah, sure.
Just so that I understand. These figures are the results from some organizations that you have tested this umbrella standards on. Is that right?
Yes, we sent the, we discussed the process with the governance board, and we sent this Delphi survey to all members of the governance board, to all task forces and working groups, and to all national network coordinators, and to some individual network experts. Okay. So we did receive comments back from Sweden as well.
Yeah, I know.
Yeah. So this all went into this process, and yeah, so that is a kind of consultation we've conducted. Of course, what is really important are also the qualitative comments, and we haven't been able to analyze them in great detail, but here you can see some examples. I don't want to go into detail, you can read them. We need to reflect a little bit on how we can, you can leave the comments, Keriin, please. Thank you. We need to reflect on these comments now to see what it means for the overall phrasing and structure of the standards, but they are very helpful indeed to make us move to the next phase of the Delphi. And with the reflection on those comments, we will then go into the Delphi phase 2 to have a rating on the individual items under each of those standards. Next, please. So that was on strategy and standard, and the third really important piece of work we are looking at the moment, and we're just starting really, is an e-learning and implementation platform. And the idea of that platform is really to provide more tangible output for the national coordinators and also the people that you're working with in the health service organizations. We do have a lot of documents and outputs at the international network level. We've got standards, implementation manuals, we've got recommendations from working groups, and we've got a lot of expertise. And we want to use this expertise to build a more common learning sets, because the similar to the work on the standards, health promotion is a really broad field, and we want to support our stakeholders better in getting started and understanding what is the evidence and what is the background and where are the key areas of activities. So based on the knowledge that we have in the network, we will develop this e-learning platform. But it's not just a learning platform to learn about the history or the concept of health promotion. It will also be a platform that helps supporting the implementation in networks and in health service organizations. So each of the modules in the e-learning platform will be built along the 3 components that are described here. We will, of course, review the background, the evidence and methods, say where does the notion of health promotion in hospitals come from, what have been the developmental phases of the network, what are the key theories and methods underpinning it. But based on that, and that is the first learning component, the second one will be to identify a leadership component. We want to identify what is the key leadership issue that is required for someone to take on this task and to implement a project or an improvement locally. And we will design the platform in a way that it helps teams being put together and work together on common tasks. And I don't know yet how we will do it in the detail, but we'll also plan to do different language versions so that the Swedish colleagues can work in their own language, the Germans in their own, and so forth, the Spanish in their own. There will be subgroups in the network. And we will also provide specific tools through the e-learning and implementation platform to support the work in the health services. You will also see a link from previously perhaps activities that were not well aligned, because the standards that we are developing are more closely related now with the strategy that's being developed, and the e-learning and implementation will be aligned with the standards that we are doing. So there will be much stronger emphasis on aligning the key messages in the network. Next, please. You can go over this. Next one, please. And if you just want to get a little bit inspired about this particular objective, I can recommend that you might have a look at the IHI Open School. I've been involved in that 10 years ago when it was set up, and it has now almost, well, if I round up, almost 1 million learners worldwide, thanks to the great effort of the Institute for Healthcare Improvement. And the Open School focuses a lot on patient safety and quality improvement in the clinical context. What it has been amazingly successful in doing is, it's not just a learning platform, it's also a doing platform. So we want to follow this example and bring people together locally to use the tools and develop projects and feed them back to the national and international level, so that we have a much stronger emphasis on implementation, supported through the technical and academic output of the network in the future. Next, please. And that was the last slide already. So I hope that gave you a little bit of an overview on what we have been doing in the last month, and more importantly, what we're planning to do in the next month. We very much want to align, of course, our work with the national networks, and I'm happy that Keriin and I will be able to speak on similar occasions in other networks in the coming months. So that's really important for us to have this kind of opportunity to engage with you. And with that, I want to close and leave the rest of the time for you to ask Keriin and I any questions. Thank you very much.